And welcome to today's webinar featuring a whole focus on medical aspects associated with COVID-19. I'm your host, Walter Lascos. This is a health and wellness series, part of our health and wellness series sponsored by Cooperative Credit Union Association and the Alera Group. And joining us with the Alera Group is my good friend Todd McDonald. I'm going to call upon Todd that's on the screen to say a few introductory remarks. Todd, it's all yours.
Great. Thanks, Walter, and good afternoon, everyone. Delighted to be here on behalf of Alera Group and formerly Comprehensive Benefit Administrators. We're delighted to be with you. We're delighted to carry forward this webinar series on health and wellness. It was just a few short months ago where my involvement took hold, and we were lucky enough to have Kristen Hamilton talk about some of the habits and eating strategies around COVID-19, followed by Carol Tholen, who talked about telemedicine and the impact and importance of that during this time. And then certainly Kip Hollister talked to us about really emotional intelligence, staying above the line, and so forth. So we've had some tremendous guests with us, and we're delighted certainly to have another wonderful one today. Before I introduce Nick Argy, I just wanted to, again, express our sincere appreciation for being part of the CCUA relationship. Alera does not certainly take that lightly. We have strategy in place to really bring more value to the organization as we head into 2021, and there's a lot of work being done behind the scenes. So you will be seeing more of us, more of Alera, as we look to add value to the association and really honor what has been a tremendously long and prosperous relationship. So with that, it is my sincere pleasure to introduce Dr. Nick Argy, who has joined us today. And I'd like to just give a quick bio here, although I don't know if that really can happen with a gentleman like him, but here we go. After graduating from Boston University with both a BA and JD, and may I say in six short years, that wasn't enough for Nick, so he went on and pursued a JD at Boston College, and then ultimately did clinical radiology work for the next 30 years. And then at Brigham and Women's Hospital, Nick worked as the chairman of the radiology department at Cape Cod Hospital to ensure efficient, high-quality readings and extraordinary customer service and satisfaction ratings. With his interdisciplinary experience, he also worked with medical malpractice insurers, the Massachusetts Medical Society, the AMA, as well as the ACR. So the question is, with all of that background, what is he up to today? And maybe he can add some color to that when he jumps in here, but stepped back from clinical practice and decided really to lead into his other passions. And those passions are education and patient safety. He loves to teach at the undergraduate and graduate level across health policy, healthcare quality, bioethics, and so forth. In his consulting practice, he works as a senior medical advisor, certainly does that for CBA and one of our Alera firms that, again, has had the proud relationship with CCUA, and ultimately, provides guidance on how to improve patient safety and efficient care. And then the unthinkable, in his free time, and I'm still searching for how that could be, he talks about his 3 charming kids and the time he loves to spend with them and enjoying some Greek food. So it is my sincere pleasure and honor to invite and ask Nick Argy to join us today. And Walter and Nick will have a regular conversation around COVID and the pandemic, and ultimately try and bring some awareness, value, and education to all of you today. So Walter, again, thanks for having me. Nick, delighted to have you here with us, and I'll turn it back over to the two of you.
All righty. Todd, thank you so much. Nick?
Thanks for the kind invitation. The introduction, that was really sweet. And just remember, it's Nick, and I put my pants on one leg at a time.
Well, listen, I think we're going to do another episode of this, but we're going to focus on the Greek recipes that we could talk about.
Well, everybody will enjoy that more than talking about COVID. That's for sure.
All right. Well, we're going to see Todd back toward the end of our little program here. So Todd, we'll bid you farewell momentarily to the green room, and we're going to turn it over to focusing on Nick. And Nick, basically, when I look at it, a lot has happened. A lot of water has passed under the bridge since the last time we were together. talking about the pandemic, and I guess that was like August is when it was. And we learn much more now about the behavior of the virus. Several vaccines now are pending approval that promise to be effective, in combating the virus. But let's begin with a look at the virus itself, and then we could talk about the vaccines. What are some of the most recent facts that we've learned about COVID-19, its transmission, its symptoms, its impact? If you could share some thoughts on that.
So the evolution of our knowledge in the past 9 months, it's almost actually scary. It's almost 11 or 12 months, but is that we've recognized a lot of things that were just completely not suspected. And they call it the novel coronavirus because that's exactly what it is. It's novel. We don't have any experience with this. So, at first there was a lot of discussion of, the fact that this was spread by droplets and that you had to wash your hands and you had to clean surfaces. What's evolved over the past 10 months is that there's been a profound recognition that this is not spread just by droplets. This is an aerosolized virus. So the difference is that it's a size issue. So droplets are affected by gravity and just come out and then drop straight down. And again, if they're smaller, they travel a little further. Aerosolized literally means they float in the air and around. And so what we learned as well, which was fascinating, is that which was unsuspected when this first came out, was that a huge percentage of the population is asymptomatic, yet can transmit the disease. This is really, really important. And I hope the audience thinks about this for a second. So if you're asymptomatic and you can spread the disease, how often are you coughing? How often are you sneezing? How often are you doing anything that would get this virus out other than normal conversation? So we might find that the asymptomatic people obviously would be at higher risk of spreading it if they were singing or if they were speaking in a public setting. But it became very clear that asymptomatic spread, and asymptomatic, at first they said it was 30% of the population was asymptomatic. Then it went up to 50. Now they're talking 50 to 60%. Some say even more of the population is asymptomatic and can spread the disease. So that's just a dramatic change. You can't just say, oh, you're feeling well, come into work. That's just not, or you're feeling well, we don't have to wear masks. I've been an advocate of universal precautions. Everywhere you go at all times, treat everybody around you as if they have the disease and as if you have the disease. And that way you don't have these problems of spread with asymptomatic people because you're on guard all the time. And this isn't something new or different or something Nick Argy made up now. We've known this for over 30 years when HIV came out. When HIV came out, we talked about universal precautions. Anyway, I've talked too much. Ask me.
No, but I find that that's interesting because if you look at it, we're going back to like March, February, but people knew about it before that even. But yet, even how many months later, it seems like there still is so much more that's becoming manifest about the virus itself that we're still continue to learn. So we still do not have all the answers or all the clarity that we would really like to have about it. Is that correct to say?
Oh, no, it's absolutely correct. I mean, it is so important, and this is a life lesson, not just a COVID lesson, to constantly be aware of you don't know what you don't know. There was a lot of discussion early on. Does COVID, can you get infected multiple times? Even if you are infected, how long does your immunity last? And the answers are we still don't know. It's novel coronavirus. It seems like based on all the available evidence is that it's highly unlikely that in short order you can get reinfected. If the general category coronaviruses, generally once you're infected, you have immunity from generally 12 to 18 months. It could be shorter, could be much longer. It's highly doubtful it will be lifelong immunity. And we still have no idea because we've generated this using, warp speed policy. We've generated a vaccine in literally 1/4 of the time and using different technologies, these mRNA vaccines, which are the two first ones that have come out, that we've never had, which is messenger RNA. Messenger RNA vaccines are something that we've never had before. It's fascinating. It's great. And the technology has driven this. I guess the sad part about the whole vaccine discussion is that 1.5 billion people in this country have virtually no COVID and virtually no deaths, and they don't have a vaccine. They just use good public health policy, non-pharmaceutical interventions. And we've always had it available, and we've never used it. And so no time like the present to use
Yeah,
it.
no, that's right. But I think it's also important to note here that I was talking to someone today, and they were saying how they know someone who got COVID, and it was like for them it manifested itself as if it was just a mild cold. Other folks get it. Oh my God! It's like they've gone to hell and back. It seems like that's another issue that's associated with this novel virus, in that it manifests itself in such a variety of ways across the spectrum of human people. From taking someone who's young and either, like, my God, confining them to bed in a ventilator possibly, to maybe a mild cold. And to someone who's older, I mean, we've read the stories over in Italy about someone in their 90s getting it and coming back from it. It's like there's no logical sense to try and get your arms around this thing.
Yeah, you're absolutely right. And this is where sort of statistics and population-based data assessment is crucial. So you might say, if you're 80, what are your risks? And we can give you a percentage, and they're very high. And if you're 15, what are your risks? What are the chances that something bad's going to happen? And we can give you the statistics. But for any given individual, if I'm looking at myself and what's going to happen, or you and what's going to happen, you can only just say within a large population. And we've all read the tragic cases of young people, 20s and 30s, dying with virtually no risk factors. And we've read amazing cases of people with lots of risk factors who have either minimal symptoms or recover fairly quickly. I guess the problem with that scenario is the human psyche. The human psyche is, I'm going to be the one who doesn't get it, or if I get it, I'm going to be the one who doesn't get too sick. And that's just a very dangerous way to manage public health. We want to manage public health based on science, data, and evidence. And the one thing that hasn't changed in the past 9 months is complete and total misinformation, bad advice, and we continue to get it. The governor of Florida, Ron DeSantis, said yesterday, I don't think masks do anything.
Yeah. Yeah.
I mean, what do you say to that?
Yeah. It's absolutely crazy. But now, not that I want to put us into a pit here or be overly negative, but when you start looking at, like we were talking about earlier, how people across the spectrum are impacted differently with this virus. Now we're talking about vaccines. If we move our conversation to looking at the vaccines, AstraZeneca has it, Pfizer, Moderna, and it's like the one is 90% effective, Moderna and Pfizer is up to 95% effective. But how is it that now how we get a virus that seems like it could encompass and cover and safeguard such a wide spectrum of individual people, because everybody's different, and be able to be effective? That seems like, is this too good to be true, that we have these kind of solutions or these vaccines that are showing such efficacy?
So, I completely agree with your message. Let's not be Debbie Downers. Let's be upbeat. So what's the really positive message? And then I'll transition and segue to the vaccine. What's the really positive message here? There's nobody in this audience that can't virtually eliminate their risk for COVID. Stay home. Don't visit your family for Thanksgiving or for Christmas. Don't get in a bus or a train or a plane or go to an airport. Those things are literally putting you and your family at tremendous risk. And the interesting psychology of family and Thanksgiving and Christmas is, who are people most likely to not wear a mask with? Are you going to wear a mask when you're with your mom and dad or your brother or your wife or your kids? No, you love them. You trust them. They could never harm you. They're not intending to harm you. They're victims as well. So we get this false sense of security for the people we're closest to do the absolute opposite of what we should do. When you're with your family, you should be wearing 3 masks, a helmet, and 12 spacesuits. That's what you should really do. But what the ultimate of what you should really do is just stay home. You know what my Thanksgiving was? It was this. It was you and me on a Zoom or on
Yeah.
a video conference, and I was by myself. I saw all three of my kids. I saw my 87-year-old mom. I saw my brother. It was a great experience. We recorded it. We'll have Thanksgiving forever. How many people have Thanksgiving that they have recorded forever? So let's be positive that we can make this go away with zero vaccine. Now the segue to vaccines. So the vaccines are wonderful. And if we have one that's 100% effective, we still have a problem. If 50% of the population doesn't take it, we've still got a problem. So we're not at herd immunity and we're still at risk. So what we need is common sense and education and reinvigorating the concept of the social compact, where we have an obligation to our neighbors and our friends, and we need to get this vaccine. And it's going to take a while to get it out. They might have 20 or 30 million doses. We need 600 or 650 million doses. Why do I say that? Well, if there's 330 million people in the United States, you need 2 doses for all the vaccines that have currently been approved. So you're going to need, and so it's a twofer. And one of the vaccines requires it to be at minus 90 degrees. That's going to be a little bit harder to get around. And one can just be frozen, so that'll be easier. So they're talking about the one that again, both of them are 2 doses, but they're talking about wide availability in June or July. So we are not out of the woods. And winter is a aerosolized bacteria. A virus's best friend. They love low humidity, which is exactly what we're living in North America, at least in the Northeast part, and more so as the winter goes on, and an indoor close situation. And again, I'm in New Hampshire, so we're there already. Dry conditions, and everybody's indoors. But there is good news. The good news is you can eliminate your risk altogether. You really can with no vaccine.
So it all comes down to, I think, the individual person. What do we want to do? What do we want to accept in terms of the facts and the knowledge that we have about the COVID-19, and realize that, yes, like you say, a positive attitude, and it's good hearing it from you, along those lines, that if we do the social distancing and the masks and and the cleanliness of washing hands and all the things that we've talked about for the last how many months about ways to combat it, that they are effective and they will minimize the potential for us becoming infected or passing it on to others. And if we could do that and stay the course, eventually we'll get to summer, June, July, and hopefully the vaccine, and hopefully people, by the numbers, as you say, will start taking that vaccine. How exactly does that vaccine work?
So basically, like all vaccines, the antigen, and it's the spike protein. So everybody's seen pictures of this virus with all these little spikes coming off of it. So that spike protein is what the human body recognizes as being a foreign actor kicking in and doing something bad. So what is the vaccines basically present that spike protein, but not on COVID, but in a different setting. So when the body sees it in a non-pathologic setting, so when the body sees it, it says, wow, ramp up to this spike protein. This is a bad thing. We want to create antibodies to it. And there are 2 forms of immunity. There's antibody, humoral immunity, which is antibody-based, and cell-mediated immunity. We don't have as good a measure of how to ascertain whether cell-mediated immunity is kicking in. But it's also a huge factor, and it may be highly protective as well. We'll probably know that in another year or 2 when we look back on it. But with the humoral immunity and the antibodies, which are the things that we always seem to be measuring, you get this awesome opportunity to create an immediate response. So if you have those antibodies to the spike protein that you got through a vaccine, the minute the real COVID virus hits you, your body's already ramped up. It's like we already loaded the gun, the ammunition's ready to go, the powder's dry, pull the trigger, bye-bye COVID. So it's a great, great technique.
Definitely. Now, we have about maybe 5 minutes or so left. I'm going to put you in a little bit of a different situation here. I am going to ask you to put on your coach doctor's hat as a coach and start thinking about all those young people, well, maybe not so young even in some cases, who work the front lines at our credit unions. right? They're important people. They are like first responders. They are essential workers. So a lot of them keep the money flowing and keep the members having access to their funds at the credit unions. So a lot of them are maybe split into teams that come into the branch, work for a week and then they work from home while team number two comes in. But they're constantly being exposed. They're constantly, not working from home totally, and being the potential of being exposed and impacted. I know one credit union member. They opened their branch. They had to close their branch because somehow someone came in that was you know COVID positive, and because of that now everyone has to sequester themselves for that 2 week period. But if you were a coach to really get those frontline folks that are working so hard doing this, to keep them focused so that we can get through the winter, because it doesn't look like it's going to be an easy winter to get through. But to get through it, I'm just going to turn it over to you, Nick, and let you kind of encourage people. We need to hear you.
Yeah, no. So it's a great question. And I think what each branch and each team at each credit union can do is figure out what works best for them. So I just recently went to the bank. I had to deposit a check because I couldn't.
Wait. You said bank?
Oh, sorry. My apologies.
Oh,
I'm trying to
my.
remember if you know what? It's time to change to a credit union.
Yes. I'll get you there.
So basically, I used the drive-through. I couldn't deposit using my phone, so I used the drive-through. What's the risk? Virtually none. I've already mentioned that, washing your hands in fomites just mean inanimate objects, is the lowest risk. I will doubt in retrospect if we say even 1% of cases were spread that way. So your other options are just, again, creative management and employee solutions. Do we schedule patients? You can tell my medical background. Do we clients? In advance, say, please call the branch. We'll tell you to come in at such and such a time. Do you literally have a line that goes out so that you can deal with people who need to walk in? Where do you put up your physical barriers? How do you protect both your clients and yourselves in that setting? How far apart do you put your people? How do you get out to your clients? Use the drive-through if you have a drive-through. How do you get out to your clients? How do we schedule so that we know we won't have more than one person in every 10 minutes, and identify what the transaction they want to do is? If their transaction is going to take longer, then obviously you book them for more time. There are so many. So I don't know anything about credit unions. I'll be honest with you. What I know is people and activities and flow and how you protect people in a public health sense. And the way to do it is to distance them and to space them out and to use plexiglass and to make sure everybody's wearing a mask and that you have a mask dispenser before anybody even walks in the door, and that everybody in the building's wearing a mask, and that you have wipes there. And all those things can be done and keep that very, very safe. The other thing is to make sure that anything that can be done remotely should be done remotely. Some transactions absolutely require you to be in person, but if a signature card can be signed and mailed, sign it and mail it. If it can be signed and emailed, sign it and email it. Figure out every opportunity to limit human to human interaction. Now, the one thing I didn't mention that I think the audience should understand is, if we shut down hard for 4 weeks, okay, not 6 months, 4 weeks of just requiring everybody to stay home, requiring all foods to be delivered to you, the virus would go away. 99% of the virus. The virus's incubation period, this is what people don't recognize. The virus's incubation period is 7 to 10 days. We used to say it was 14 days. So what happens to, even if you have people in various degrees of infection, if you're literally on day 1 of infection, you will manifest disease, or you may be asymptomatic, but generally within 4 weeks, you have either cleared it or you're in the hospital or you're still coughing. So if you're symptomatic, your ability to spread it is higher, but we know you're symptomatic. And if you're asymptomatic, the vast majority of people clear within 4 to 6 weeks. So if you think of what happens to the virus has nowhere to go if there's no human to human interaction. So I'm hoping that with a new administration that some common sense will kick in. And I think that your credit union employees and management can work together to create amazingly creative solutions that will keep both their clients safe and themselves safe.
Nick, that's such good words of wisdom, and I really do appreciate having you being with us today. I think it was just so important to hear from you and to get a clarification on a lot of the things that are, related to COVID and the vaccines coming up, and to really start looking at, yes, we can get through this winter. We can make it. We could, if we continue to do what we know is right and need to do, we can make it to the spring. The vaccines will become available, and maybe we could really start going to Fenway Park this summer, possibly. We'll see. Keep fingers crossed. Todd, how about any closing remarks? You were able to sit and listen to us as we
Absolutely.
chatted along.
I'm amazed you were able to keep it to such a short time frame. Obviously, a wonderful, wonderful dialogue. I happen to still be stuck on the notion that Nick got a degree, a BA in his MD in 6 years, and then went on to get a JD. So you lost me. I couldn't get beyond that. Truth be told, an amazing dialogue as I think through some of the things we're dealing with our clients, and CCUA being certainly one of them. The message appears relatively simple. And it's, put on a mask, even with family, take no liberties. If we have to shut down for 4 weeks, what really resonated was that could end up curing this virus. It's that simple. So can we do it together and so forth? So wonderful, wonderful message. I appreciate that, Nick. And again, on behalf of Alera, we're just thrilled to be a partner. And I underscore that term partner. We're thrilled to bring value, and hopefully this wellness series, most notably today, does hit that mark. And we'll look to continue to bring on additional speakers and resources and so forth. So again, it's our honor, it's our privilege to be a part of this. And I'll turn it back to you, Walter, to wrap it up here.
All right, Todd, thank you so much. And again, Nick, thank you too for participating today.
My
Folks,
pleasure.
before I let you go, I just wanted to call attention to something that you may be interested in. For the past several months, all of us at CCUA have been using a little app every day. I don't know if you could kind of see this here, but it's called I'm Healthy Today. And on this app, on my phone, every morning, what happens is I get a series of questions that I need to go through and basically answer yes or no. And what it does is it keeps me focused on staying safe, staying healthy, and being mindful of the COVID virus, so that at the end of everything, as I go through taking these questions, it basically tells me, are you, free to go back into the office to work, or do you need to see a doctor or seek medical support? And if it's the latter, they automatically put you in touch with someone that could provide that kind of assistance and service to you. So again, I just wanted to call that to everyone's attention, because you at your credit union may be interested in this app called, My Health. And if you see right there on the screen, private client at cbacompanies.com for more information about this app. It's definitely worth looking into, and I really do encourage everyone to take a look at it, and basically, if it works and if it helps you get through the winter and helps your whole team at the credit union be successful and staying safe and keeping your members safe, it may be worth looking into. Again, thank you so much for joining with us today, and I want to thank Dr. Nick Argy and Todd McDonald also for being part of our discussion, and we thank you most especially for being with us. Take care, stay safe.
Stay safe. Happy holidays.